Good afternoon, everyone. Thank you for being here. I'm joined with Shari from the Deaf Action Center, as well as Dr. Joseph Kanter from the Louisiana Department of Health, our Jefferson Parish Coroner Dr. Gerry Cvitanovich, our Emergency Management Director, Joe Valiente, as well as Councilwoman Jennifer Van Rankin for District 5. So, we'll go over our COVID numbers for today. Today, our totals for Jefferson Parish is 20,357 cases. Unfortunately, 621 deaths, so that's an additional 164 from yesterday with one additional death. Since mid-August, we have been managing this very well. We were having about 30 to 60 cases per day, and that's the same plateau we saw earlier in the year. If we plateau for a while, it ranges between 30 to 60 cases a day in Jefferson Parish. Last week, and we could kind of see that earlier in the week, we went from 35 daily new cases at the start of the month of November. And certainly for the past several days, starting last week, we've seen that rise. Our daily cases, our daily positive COVID cases have been in the 3 digits, again, today being a positive 164. So as I was mentioning, we can see this demand for testing happen. It's the same thing we saw in the summer when the demand for testing starts increasing, and Joe Valiente will be here to speak about Ilario Center. We kind of brace ourselves, and then a couple days later, we see what we fear, the COVID numbers increase on the dashboard, and that's certainly where we are for now. So the reason for this press conference is to say that we are out of the stage that we have been in since mid-August of 30 to 60 cases a day. We are seeing the triple-digit increases in the cases, and it's an unfortunate time for us to be going right into Thanksgiving holidays. The traditional Thanksgiving holidays, the very nature of it is risky behavior. It's a lot of people surrounded at a beautiful table, beautifully set table with a lot of, effort put into that, eating, talking, maybe for hours, just sitting there enjoying one another's company in a dining room, in a living room, in a house. That traditional Thanksgiving behavior is exactly what we fight against to manage COVID well. Large groups, together around a table, poorly ventilated room, talking at one another for hours. Okay, so now is the time that we're really imploring everyone to start making your strategy for celebrating Thanksgiving a different way next week. Especially critical is that we mix generations of families together. My kids will come back from college, my mother will be there. What is going to be my strategy for dealing with that? My mom has been very good about staying put. My kids are in college, different set of behaviors. I'm putting them all together in one room. No, that is not going to be our strategy in our household this year, and we're making a different strategy. We'll be eating outside, and we'll be set apart. I already bought little tables that the old-fashioned TV tables, and we're going to enjoy each other's company, but we're not going to be in each other's faces, and we're definitely going to be 6 feet apart. So we want you to encourage yourself now to start thinking about what your Thanksgiving looks like for next week, okay? Make that strategy. We want you to encourage to spend the day just with members of your household. Consider spending it virtually with a larger group of people or the family members that you would normally see on Thanksgiving. You increase your risk when you bring people together from different households. Obviously, as I mentioned, college kids will be returning home from school, and you're going to have multi-generations together. Historically, and I don't think that's the case this year, but historically, this is a week where we have a lot of travel going on, and that is risky in and of itself, as people from other communities coming into your community, staying at your house. So outdoor gatherings are certainly less risky than indoor gatherings, especially in the poorly ventilated spaces. So if you're going to be inside and you find yourself stuck inside, considering opening the door and window and getting some of that breeze in. Longer gatherings pose much more risk than shorter gatherings. So you finish eating, everybody's at the table, you can spread out more to have your longer conversations and enjoy each other's company. Remember to social distance and wear your mask. So when you're not eating, put your mask back on and enjoy each other's company. You want to limit the contact with the commonly touched items in the serving utensils. So in my household, I put the food on my island and everybody's reaching over everybody else and touching the same spoons at the same time to get their plates. That has to look different this year, considering plating it with one person plating in the kitchen and then serving it to the people at where they're sitting, hopefully socially distanced. So we want to limit the contact with the serving utensils. Again, encouraging one person to serve food rather than having it in the common areas and everyone crowding to serve themselves. We want to discourage potluck dinners. We want to consider delivering meals to members and neighbors who are high risk and let them stay at home and enjoy their Thanksgiving meal at home, and you can deliver the food to them. And of course, certainly the traditions of Thanksgiving are with shopping on Black Friday. And so many of our stores, we want to encourage your spend. You can get some great deals on Black Friday. Many of our stores have online platforms that are very, very effective. We want to encourage you buy local, but wherever you buy, consider doing it online or curbside if they don't have that. And so many of the stores that don't have online services will certainly help you, be more than willing to help you and bring it outside. So again, implore you to start now having those discussions with your family for your Thanksgiving strategies. Let's go over testing. We have free testing. We've been having free testing since March, something we're very proud of, at the Ilario Center from 8 to 4, Monday through Friday, and on Saturday from 8 to 2. And again, I will have Joe Valiente coming up and discussing Ilario Center a little bit more. For those of you who are not linked up, covid.jeffparish.net has a link to Quest, and you can pre-register for any of that stuff. Also this week, we've been partnering with Ochsner on our community testing centers. Wednesday at Tarrytown Golden Age Center from 12 to 7 p.m. Thursday, Ochsner's doing their own testing with St. Michael Baptist Church in Kanter from 9 to 4. And we partner again with Ochsner on Friday at Johnny Bright Playground from 9 to 3. Seniors on these Ochsner testing sites do have first priority in the morning, in the first hour. So seniors will be pulled out of line and taken in priority. Everybody can go at the beginning of the day, but seniors will just have that priority. And as I mentioned, demand at all our testing centers is up, and we're seeing ourselves reach the quantity that they give us at the testing centers, an indication that coronavirus is surging in our community again. So, Jefferson Parish Alert, we did not, for those of you who get the alerts, we did not send out texts on Sunday and Monday. We needed the time to interpret the data because the state pushed out a different way of showing the data with probable cases and confirmed cases, and Dr. Kanter will go more into that depth. But we needed a little bit of time. We resumed our texts today, and we're going to start from now on just posting the total increases in deaths per day. And if you're not subscribed to our JP Alert, I encourage you to text JP Alert, all one word, to 888-777, or for our Spanish-speaking individuals, text JP Noticias to 888-777. So with that, we're very happy to have Dr. Kanter back with us. Dr. Kanter was formerly and probably still is serving in many of the duties as our Region 1 Medical Director, but was promoted to the Assistant Secretary of the Office of Public Health. So I know he's so very busy, and I really want to thank him for being with us today. I know you're doing double duty with both of those roles, so thank you, Dr. Kanter, and hopefully you can explain some of the changes on the dashboard. Dr. Kanter.
Thank you, Madam President, and thank you for your leadership throughout what has now been 9 months of this pandemic. This is not the conversation that we had hoped to be having at this point in time, but unfortunately it's one that we have to. Folks will know that over the past 3 or 4 weeks, almost every other state in the country has been experiencing increases. It's now the largest outbreak nationwide to date. For the better part of the month, Louisiana was able to hold steady and maintain the progress that we had after our second wave, which was July and August. That luck has run out. And really over the past 7 to 10 days, we've seen sustained increases in Louisiana. So now, unfortunately, in every region of the state, we have increasing cases day on day, and we have increasing hospitalizations of COVID patients. Every region of the state, the Greater New Orleans region, or Region 1, certainly included in that. A new round of data is going to be posted tomorrow on the Wednesday update for the dashboard. It's going to show that percent positivity for Region 1 has increased from 4.1 to 5.1%. Statewide will be above 7% positivity. So it's a perilous time for us for a few reasons. Number one, it doesn't take much to look around the country and see where we are headed if we don't turn this around. There's no way around that. This is very similar to how our second wave started. Folks will remember that we were watching big spikes in other states, Arizona and Georgia, Mississippi. And then a few weeks later, we experienced that here. So that's what we are concerned first and foremost. The second part of that, as Madam President mentioned, is with the holidays approaching, the risk is even higher. We know when people come together and congregate in gatherings, and particularly when they travel from other areas in, that can add fuel to the fire. In fact, it has many times before. So we're looking ahead. We see increases across the country. We see the beginnings of increases here. We are in the middle of a sustained increase, both regionally and statewide. And we have the holidays coming upon us. The risk is high for families. There's just no way to sugarcoat that. And I think families need to be careful. They need to be very careful and thoughtful about how much risk they're willing to take on. And I'll remind friends that one of the scariest things about COVID is that about 50% of people who are infected have no idea because they have no symptoms. So I could be infected, I can be infectious, be a risk to those close to me and have no idea. And the challenging thing to internalize about that is it doesn't matter if it's someone who you're friends or family with. That risk is the same. What we've seen from contact tracing data over the past couple months is an increase in the number of cases tied back to informal small gatherings. Dinner parties, game nights, backyard hangouts. And what we think is going on is that when people are with friends and family, people that feel comfortable with, they let their guard down. But with so much asymptomatic infection out there, just because you're familiar and comfortable with someone and close to them, the risk is just the same. And so that goes for Thanksgiving. My ask of families is to take a real long look at what you are comfortable with in terms of risk. Families that have had the unfortunate experience of knowing this virus up close will tell you that the temporary joy of bringing people together is oftentimes not worth the potential permanent consequences. And this is something that no one's going to police for families. It's a decision that each family has to make, but I really want you to think long and hard about how much risk you're willing to take on. It's one Thanksgiving. I'll tell you, we went through this exercise with my family last week, and we decided we're not going to bring people together this Thanksgiving. We're going to do it better next year, and it's not worth it to us. You know, I think if we're not careful this Thanksgiving, then Christmas and New Year's is not going to look anything like what we want it to. I mentioned that we're on an increase now. We're at the beginning part of that increase. You know, you really don't know what it's going to turn into until you're there or even afterwards. So we can't say what's going to happen. All we can say is we look around the country and we have the experience now of going through 2 spikes. And what we're seeing right now looks a lot like what we saw at those stages of the other spikes. We think we have a window of opportunity right now that we can turn this around for the state and the region, but that window is closing. It's closing as we speak. And the actions that we do or don't do over the next 1 to 2 weeks will make the difference. So for families, both for the risk that you would take on to yourselves and your loved ones, and also in the interest of reducing community spread, which is on the rise, I ask you to really think hard about what you're comfortable with for Thanksgiving and the holiday season coming on. I do want to note, as the President mentioned, a couple improvements that were made to the LDH COVID dashboard. We standardized the reporting of percent positivity, so you'll now find it as a weekly cumulative measure throughout the whole dashboard. And I gave a kind of a preview of what the percent positivity will be displayed tomorrow for the region and the state. And then we also further incorporated antigen testing. I'm happy to talk about this more offline or afterwards, but there's more and more antigen tests being used out in the community. They have pros and they have cons. The pros of them are that they're typically fast, 15, 20 minutes. They're typically done right in front of someone. They don't require a big lab to run. They're inexpensive. The cons is that they're usually not as accurate as the formal test, the PCR test that requires a lab to run. But more and more are being done. They're valuable, and they give valuable information. So those are now being incorporated into the total testing number. There was some concerns initially about people having false positives. Those haven't panned out the way that some people feared. So in all likelihood, if somebody has a positive antigen test, they have COVID, and they need to be acting like they have COVID, isolate themselves, close contacts, quarantine. If you go on the dashboard, you can see exactly which tests are PCR, which ones are antigen, and you can go back historically and see for previous days what that breakdown was. We've had antigen tests being reported all the way back to May, but increasing in numbers over the past few weeks, and it'll continue to be more prevalent. Just to bring to a close, again, I think people should watch the dashboard for trends, but just know we are in a dangerous place right now. In this region and Louisiana, we have an opportunity to turn this around. We know what happens if we don't. We have an opportunity now. We really do need to capitalize on that. Madam President.
Thank you so much, Dr. Kanter. Next, we'll have our Jefferson Parish Coroner Dr. Gerry Cvitanovich.
Good afternoon, everybody. Like Dr. Kanter said, this is our third wave now that we're entering of the COVID. That's the bad news. I guess the good news on that is that this isn't our first rodeo. It's our third rodeo. As a community, as a state, as a nation, we have proven that when we take this seriously, we can bring down the numbers and bring them down relatively rapidly over a several-week period. So I encourage everybody to get started. And on a personal note, I'll mention that I'm part of the third wave. A couple weeks ago, my wife and myself turned up positive. We had no idea, even though I think we were trying to be diligent because of my position, wearing masks and everything, and yet we still wound up with it and beat our brains and couldn't figure out where we got it from, but ultimately wound up giving it to our kids as well, which really caused hardship on them for school. So I would encourage everybody to try your hardest, wear your masks, watch your distance, and stay diligent, and try your hardest to take all that to Thanksgiving and have a safe and healthy Thanksgiving. Thank you.
Thank you, Dr. Setanovich. Next, I'm going to ask Joe Valiente, who is our Emergency Management Director, been a very, very busy man this year, to come up and give some updates on Ilario.
Good afternoon, everyone. So, as everyone knows, on October 24th, we participated in the mass vaccination exercise, and we were able to incorporate the lessons learned from the COVID testing drive-up site into the vaccination process. So, we feel ready and confident that as soon as the vaccine is available, that we'll be ready to go in a very short notice of time. In the meantime, though, the Ilario Center is still open. We did move the initial site from in front of the Ilario to the south side of the baseball stadium, which is located right next door to the Ilario Center. And that process is going to serve us better for the future when we do incorporate the COVID vaccination process. So we're still open the same hours, they're still available. You don't have to be symptomatic. The wait time is less than 10 minutes. I do want to follow up on a note that the parish president mentioned. We have seen an uptick. Last week, we were averaging about 80 tests a day. Friday, Saturday, and Sunday, Monday, we're looking at close to 149 to 145 each day. So apparently the citizens are concerned, or they're having symptoms, and they're coming in to get tested. So it's important that the public realize that we're still open at the Ilario Center for COVID testing. Thank you.
Thank you, Mr. Valiente. So with that, does anybody have any questions for any of our speakers this afternoon? Yes. Hi, Jennifer.
What about Mardi Gras? Made any decisions? Big decision made down the road about parades?
So the question is about Mardi Gras, and of course this is a very complicated matter, as you can imagine, this year. I will want to acknowledge Councilwoman Jennifer Van Rankin. Her district really houses the majority of Carnival for us, and really has been really very proactive in growing Carnival, and I'll have to say improving the quality of Carnival, Family Gras overall. It's been some of the best years we've had. It's very complicated, and to be honest, I would have said earlier in this month I would have felt better about it than I do today. our numbers are going up. I was able to, the councilwoman had a meeting with all the captains last Thursday night, and she was gracious to invite me, and I was able to tell the captains that COVID is going to rule the day on this. The difficulty with this is the business model for the Carnival cruise, and I want to respect that. I want to respect them, and that this is their livelihood, this is their passion, this is what they do for us as a community, this is our history. And it's also, they have to be able to not lose money on this proposition as well. And the difficulty we have when we think of Carnival is they need a lot of lead-up time to prepare. I mean, the beautiful shows that they put on for us don't come without a lot of effort and with a lot of expense and without a lot of resources. That prep time is months ahead, whether it's securing floats, tractors, tractor drivers, costumes, throws, getting the membership to pay their dues, all of that. And COVID doesn't give us that time, unfortunately. And I will tell you, last St. Patrick's Day, I had to stand in front of you all and cancel St. Patrick's Day 4 days ahead of that event. Not fun for them, less fun for me. All that resources, all that expense straight down the tube. I don't want to see that for them this year. But do we need Carnival? Absolutely we need Carnival. We need Carnival more than probably we've ever needed it, I would say. Probably even, 2006 we needed Carnival. We need Carnival, in 2021. Very, very difficult issue for us. But a successful Carnival is one that doesn't necessarily go with COVID. A successful Carnival, how we judge it in prior times, is high crowds. We want our hotel rooms packed. We want the music industry to be very involved. We want crowded bars. We want crowded restaurants. We want the people who stay in hotels to go shopping. That's just sort of against all the messaging we're putting out today. Today I'm concerned about your dining room on Thanksgiving. So it's hard for me to envision us inviting large crowds unless something drastically changes with the numbers. And I don't want to kill hope. If I have to be honest, I also don't want to give false promises. And I certainly don't want, the prospect of Carnival Cruise spending a lot of money that they can't get back when we don't know what COVID's doing. Again, I would have felt much better about it early in November. November 13th, I think, the United States posted the highest number ever since this pandemic started. The same day, Louisiana posted the highest number ever since this thing started. And that's where we are with COVID in the world. I feel certain that if we can't have it at the time that it normally is scheduled, our council office has been so proactive. They call me all the time with ways with the business community in the signage and all the different phases. Our council office has been tremendous in doing, very receptive to the business community and doing whatever, bending over backwards really to do whatever is needed to minimize the damage. And I feel certain they would be open to, if we can't have it at that time, be open to any creative ideas anywhere in the community. So that's where we are. It's still 3 months out, but if we knew what we knew after the fact, we wouldn't have had Carnival last year because that was a silent spreader. I believe it put us in the first surge that the rest of the southern states didn't go through, and that's where we were last year. We wouldn't have done it. So the question as a community is, knowing what we know, is it appropriate to do? And again, it's 3 months away. I know the crews need to start making decisions, and we're very much in communication with them, but it is difficult. And honestly, that's the best assessment I can give of what I think of Carnival next year. Yes, Rob?
The captains any kind of a date or they give you a date, you really need to know by this time?
We did not do a drop dead date. And remember, Carnival is brought to you by many people. Certainly our council offices, the Councilwoman Van Rankin's offices, because so many of them go through her district. She's extremely involved in Carnival every year, as I was when I was District 5. The entire council permits that. I have 11 departments that support Carnival on the street. I have concerns of their safety. If it's high, then I can't, in good faith, if I'm not comfortable going in the crowds, I can't put my employees out in the crowds. And I don't think anybody really wants that for our community, not our council offices either. The sheriff's office, obviously, is a big player in this. Our EMS, our fire departments. There's a lot of different organizations that do Carnival. Now, what I do is an emergency proclamation, which was what I had to do last year to stop it at the last minute. I don't want to be in that position again. I really don't, because that's their money down the drain, which, I definitely, that's the last case I want to be in, is saying we can do this, and then the COVID numbers spike up, or we have a lot of deaths a day or two before the parade, and then I have to do an emergency proclamation, and everybody's disappointed, including myself. And that's a lot that I just don't want to, that is the last case scenario I want to be in. So that's why I have to give an honest assessment that COVID is really not cooperating with us right now. And the time is getting shorter because they cannot put on a parade in a week. They just can't do it. That business model they have, they're not able to put it on in a week. And it just takes a lot more preparation. And where we are now, it's difficult. And I would have had a lot more hope earlier in November. But you know, our country is seeing the highest levels. If you look at the ups and downs, the ups are now are much higher than the two increases we had earlier in the year, in March and April, and then in the June, July timeframe, we're just at a higher level right now. So.
So it's really hard to envision you giving the green light at any given date, given the numbers can be fluctuating just like they are right now.
Rob is asking if we could give the green light. I'm not in a position to give a green light in COVID no matter what. I mean, I just can't. And I think, you know, probably the best medical advice, I spoke to a doctor a while ago when I was asking, you know, this was early on, what's happening, what's this, what's that, and he said, I can't tell you that. You know, the best advice is there's no certainty with COVID. We certainly see that. I did not think we would be here at this time, but now what we're seeing as time goes on is that I do think what we're doing well. We remember, we started out in phase 3, 75% at our businesses to balance that. Football games starting, all of these schools starting, and I thought for sure we would have gone up, and we managed it really well, and we stayed low during that time. So that's a surprising thing to a good effect for us. I don't really know, you know, if people are starting to, you know, the medical community saying it's these private parties, people just letting their guard down in their homes with their friends, if that's the reason for this uptick or not. But it has been very unpredictable as to when if you look at it, it's like a 2-month up and a 2-month down so far, and then look like we're coming up again. So the mitigation measures work because I have every belief that if we weren't doing these things, it would be worse. So, but again, Carnival is very difficult for those reasons. Yes.
Sure, Jennifer. You're thinking about school closures and yeah, it's a great question, Jennifer. It's you know, at the end of the day, there's no magic number after which a school gets closed. You know, what the Department of Health does, the Office of Public Health, with a school or a school district when there is a case, is they talk to the school, they talk to families involved, and try and learn about if there's a likely scenario of how the case was transmitted and who's at risk and who is exposed and so forth. It's very rare that the Office of Public Health actually recommends that a school gets closed. When we do, and I can't remember the last time that we did, to be honest with you, but it's because we have evidence that there is ongoing transmission into schools, cycles and cycles of transmission, and that something needs to happen to break that cycle. But that really is rare. What happens more often is that the Office of Public Health in the school will perform some contact tracing, understand which students and teachers were in close contact with the positive case, and then there'll need to be some quarantining, and a certain number of staff and students will have to be out for 2 weeks quarantining. Now, sometimes a school will take that and say, well, listen, if 20% of my staff are out, or 30% operationally, it's too challenging to hold school, so we'll shut down for a few days. That tends to be the more likely scenario. I will say, though, on one hand, I think schools, as the president said, have just been tremendous. I mean, they've really worked hard. Administrators, teachers, and the families to make a safe environment. And it's evidenced by when we've seen a lot of cases that needed some quarantine, but we've not seen a lot of transmission. You know, people get exposed, get a case on the outside, they have to stay home from school, some of their contacts need to quarantine, but we've not seen secondary transmission in schools, which tells us that schools are doing things right. They're making a safe environment. The one exception to that, I think, is we've had some challenges with extracurriculars, football practice and other things that we need to work on. But by and large, the classroom environment, because of the efforts, has been safe. On the other hand, the risk in a school, just like the risk in a nursing home or another setting, is really contingent on how much community spread is happening on the outside. And the more likely that teachers and students are going to be exposed to COVID on the outside, the more likely they're going to bring COVID in, and the more likely there'll be COVID in the school. So I do think we need to watch it closely. I think families, need to pay extra attention if you have school kids. Talk to your kid about how to wear a mask properly if they're of age. Talk to them about the need to distance. Talk about the need to wash your hands frequently. Set your kid up to be as safe as possible in school, just like you would for any other risk, crossing the street, anything. And then I think schools need to keep doing what they're doing, which is providing a safe environment.
So there's not a sense out there in the community that correlate considering, pairs wide or rooms wide?
No.
Kanter, we did a story yesterday on the most active COVID hotspot in the state is the Home Nursing Center, 27 new cases in the past week, according to you all's figures. How do you explain nursing homes still having this rate of cases when we know how vulnerable that population is and we know how many deaths have occurred in nursing homes at this stage of the game? What is the health department doing to try to enforce rules on these nursing homes, or are you all powerless?
No, it's a great question. It's one of the more frustrating parts about the pandemic. You have an institution where we know the virus can spread quickly, as you point out, and is filled with vulnerable people that have the most to lose because they're elderly or have comorbid conditions. There's been a number of improvements. I'll run through a number of them that the Office of Public Health has been involved with, and then I'll talk about the limitations of those. First and foremost, there's been infection control assessments and expertise, technical assistance. The Office of Public Health has sent out teams, both virtually and in person, to nursing homes across the state to conduct assessments of their infection control practices and to sit down and talk about where improvements can be made. That's a model called ICAR, ICAR, Infection Control Assessment Response, I think, but don't quote me on that. And it's based off of a CDC model. So those have happened to every nursing home so far, and Office of Public Health is always available to go out and do repeat visits on that, as we've been doing. So we make the expertise available, number one. Number two, we make personal protective equipment, or PPE, available. It's very important for staff in a nursing home to wear PPE when they go from room to room to break down on that spread. Third is testing. And the unfortunate part of being here in Region 1, which we had the leading tip of the spear. We had a spike in March and April before most of the country did, and namely before we had a lot of testing available. And so back then the nursing homes were vulnerable because they didn't have a lot of that testing available, and we saw more fatalities in our spike than we would have if it was a couple months later, because the testing just wasn't available. Now there's robust testing. And so by orders of both the state health department and the federal government, nursing homes do weekly testing of their staff and then weekly testing of their residents when they do find a case, of all the residents, and follow up to any positive case that they find. And that helps, but the challenge, and I think this gets to your question, is that it's not absolutely protective. And you can look at what happened at the White House gathering a couple weeks ago, where they had an outbreak despite doing very robust entrance screening testing of everyone that was there, to see that testing helps a lot. It's just not 100%. And we do have concerns as the cases in the community go up that the risk in the nursing home setting will go up as well. So the best thing is for nursing homes to keep on the testing that they're doing, maintain the PPE practices, communicate with the Office of Public Health when they need resupplies of any of those, and to continue on keeping up with best practices. But I do expect it's going to be a challenging point because, unless you are on an island, it's a porous entity. The staff go home at night. They're not locked there, and there is opportunities for spread, and that's been certainly challenging. Yes, sir.
Just a quick follow-up for Dr. Gerry. You mentioned that you had the virus. Are you doing okay? Is your family doing okay? Just
Sure. Yeah, I'm doing fine. So is my family. I got sick 2 weeks ago yesterday. Interestingly, for a week I was pretty fine with mild symptoms. Did get a little sick after that, but doing well now. Thank you.
Jared, what do you say to people who see you up and at 'em right now, see President Trump up and at 'em after 2 days, and say, "Hey, it's not that big a deal"?
Well, I'm in a lot better shape today than I was a week ago. I was exhausted for a few days, and I was surprised that after a week of doing well, and I even tried to exercise every day while I was sick, and then and it really after a week it caught up with me, and I had spent 3 days just exhausted in bed. So I would tell people, don't assume just because it's 5 or 6 days in that you're fine.
Okay, any other questions? Thank you all for being with us. Thank you very much.